Hello, for our assessment comparison analysis project, we decided to research the ABLES-R and the VB map. Our client's name is Johnny Walker, and he is a 5-year-old boy who has recently been diagnosed with ASD. Johnny attends an early intervention preschool where the staff and his parents have noticed he repeats words and short phrases of adults around him, but has difficulty responding to questions and engaging in conversations with peers and adults. This is identified as vocal profile 2, where a child has uncontrolled and controlled spoken word repetitions. Johnny can identify colors, numbers, and letters by matching them to other ones present, and currently receives most of his academic instruction through a naturalistic teaching approach. Johnny's parents and teachers are concerned that he is not toilet trained and lacks independent and leisure skills. They also hope to increase his social communication with peers and adults. Johnny's disruptive behaviors have been a concern because they involve tantruming, which for him is screaming and crying on the floor, as well as property destruction, which is throwing toys and materials. His teachers have started using a token system to reduce the disruptive behaviors and say it works sometimes.
So this is the VB map assessment. The VB map is a best fit for students who are 0 to 4 years of age. It's used to evaluate verbal behavior of individuals with ASD or other developmental disabilities. And students that are early learners with minimal verbal language and limited prerequisite skills fit this assessment well. To implement the assessment, the assessor must be familiar with Skinner's verbal behavior. It assesses 170 milestones and 900 skills in 16 different skill areas. And it splits them up into level 1, level 2, and level 3 learners. So the levels are on the bottom left of the screen. And if you look on the right, that is the way that the VB map scores are tracked, and each different color goes for each assessment. So you can see the progress that the child is making.
ABLES is used to evaluate the verbal behavior of individuals diagnosed with ASD or other language impairments. ABLES has 25 domains and 544 skills. A few of the domains are language, social interaction, self-help, and motor skills. A graph with all the domains is filled out when the assessment is completed. The graph will grow as the student continues to get reassessed. The graph shows the progress or the regression. The ABLES is used to see what skills the student currently has and what skills need to be targeted. The skills are broken down into manageable parts to build on each other.
I will be discussing the pros for both assessments and the rationale of the assessment we chose for Johnny Walker, which is the ABLES-R. They are widely used throughout the field of ABA. They both address basic listening, responding, social behavior, and transition-friendly behaviors. Because Johnny is older and has some skills, we are recommending the ABLES-R. The ABLES-R will focus on his intermediate language skills, listening, responding, echoic language, tantrum behaviors, and lack of independent and leisure skills. With the ABLES-R, the initial assessment will show what skill areas he has as compared to a typical developing 2-year-old, and if there are any disparities or blank areas. Those will be the first priority to focus on when creating his treatment plans. So choosing ABLES-R assessment would be best for Johnny.
So since we chose the ABLES-R assessment, the next steps would be to actually administer the test. After that, you'd want to score the test and review the score. From the review of the score, you would look at what the targeted behaviors that need to be worked on for Johnny and work on those areas of need. After 6 months, you want to reassess and administer the test again, following the same steps of rescoring and reviewing the score, and then looking for any other new deficits or progress that Johnny gets by doing all the targeted behaviors, and continue to work on those and continue with those steps. Here are our references. Thank you.